Hi, my name is Stefan Biput, and I'm here today with Matcha Resident to share my journey. First of all, I want to thank Matcha Resident for giving the opportunity to share about my story and also for the free merch. I really appreciate it, and I hope my story inspires somebody there today. So a little bit about me. I'm from Trinidad and Tobago, and I'm currently a fourth-year medical student at St. George's University located in Grenada. I applied this ERA cycle to general surgery, and I matched in my number one program, Maimonides Medical Center in Brooklyn, New York, in general surgery. I grew up my whole life in Trinidad and Tobago, and in 2020, I entered the 5-year MD program with St. George's University, where I did 1 year of preclinical foundations, and then I was admitted into the 4-year MD program to complete my medical degree. So, because of COVID-19, I did 2020 and 21 online, and in the year 2022, I moved to Grenada to continue my last year basic sciences. And in 2023 and 2024, I came to New York to finish up my clinical rotations and also applied for residency. Throughout my journey, I did hear about Matcha Resident, and I did follow with them through Instagram. And with them, I was able to hear other success stories of IMGs, other people's application stories, and I was also able to help me connect with other IMGs as well who were in my position a few years ago. Also, Matcha Resident has services that let you see like your program compatibilities. It lets you see which program sponsors J1, which states are located, some of their requirements, some of their step 2 requirements scores. And they also had other services regarding the application where you could see examples of personal statements, and interview prep. It greatly helped me. With interviews, my advice, yes, it's good to practice questions. Yes, it's good to have planned answers in your head. But, some interviews are virtual or in person. I did all my interviews virtually. And my best advice was just to be yourself. Like, show your enthusiasm to the camera, show your interest, show your excitement, show your willingness to work, and show your true interest in the specialty, and let that reflect of who you are and how you feel about the program you're talking with. So just be yourself in interviews. Throughout my journey, I would say my greatest challenge would be having to move to different countries. I grew up in Trinidad and Tobago. Then I had to move to Grenada for my basic sciences, and then I moved to New York to complete my clinical rotations. And every time you move, it's a new lifestyle, it's a new routine, it's finding new people to help you and support you. And I'm grateful for the people that I encountered, because without them, I don't think I would have been here today. I had really good support systems in Trinidad, I had really good support systems in Grenada, and I had really good support systems in New York. And each of them played a role and helped me match where I am today, and I am very, very thankful to them. I'll never forget them. The high point of my journey, I would have to say, would be submitting my rank list. When submitting my rank list, that was the point where I knew that everything that was in my control was out of my hands. That means that I did everything that I possibly could have for my application to be the best possible way. And at that point, there was nothing else I could have done or nothing else I could have controlled. So knowing that I did everything I could gave me the satisfaction that, like, I did everything possible. I did the best I could be. I was the best applicant I could be. And when submitting my rank list, that was a huge relief. And I just let fate take the rest of the way. And I'm glad it worked out. My lowest point, and this will always be the lowest point throughout my medical journey, was finances. Having to move to different countries is not easy. Coming out of Trinidad and Tobago, coming to Grenada, and coming to New York, having to adjust to different lifestyles, set up different phone plans, find new apartments. It was not easy. Again, my support system played a big role in helping that. And I know how tough finances could be, and it's tough for everybody. But I would say that was the lowest point in my career. My best advice for future applicants, no matter how early you are in your application, always, always, always plan ahead. It will never ever be too early, and having a plan is never ever a bad thing. Having a plan will always set you up for success, and it's something that you could always change along the way, but it gives you like a guideline to follow throughout your journey, and it helps you stay stable. Like, some of the next steps you're going to take, what to look forward to, and you know how to plan your future self to like always be the best self you could be. And with that, as my medical journey comes to the end, and my medical school journey comes to the end, and I'm going to be starting my new chapter in residency in general surgery. I'm looking forward to meeting new people, of course, having new opportunities, and being stable, and also trying to make the best out of it as I can be. Like, I'm going to be meeting new people, I'm going to have new opportunities, new challenges, and with that, I want to make myself become a better surgeon or better doctor as I can possible. And out of that, to accomplish, of course, I want to make myself grow. I want to make myself be the best surgeon I could be. I want to be the best I could be for my patients, and I also want to give back to the fellow medical students because I know how tough it could be, and I hope what my story inspires somebody here. And of course, if any support is needed, please reach out. Thank you.